HCL Communications.
How many independents we have now that are lost track?
59.
59?
Yeah. Hi, this one minute. Please. Testing, testing, 1, 2, 3. Happy Independence to the best team in the world. Yeah, I'm here. Yeah, I'm here. Is that okay? Good morning, Trinidad and Tobago, and welcome to the Ministry of Health update on the national COVID-19 response, the Eve of Independence edition. It is a pleasure to be here with you once again, and I am pleased to present today's panel of presenters. Dr. Roshan Parashram, Chief Medical Officer, Dr. Camille Green, Pediatrician, Executive Member, Pediatrics Society of Trinidad and Tobago, and Mrs. Diane Henney, General Manager, Nursing Services at the North Central Regional Health Authority. I am Al Alexander, Senior Corporate Communications Officer at the Ministry of Health, and I will be the moderator for today. Dr. Parashram will begin with the latest clinical and vaccination updates, followed by a presentation that looks at our intensive care units and the high dependency units figures for vaccinated compared to unvaccinated persons. CMO, good morning.
Hi, good morning, Al. Good morning to Nurse Henney from the North Central Regional Health Authority and Dr. Green, who will be presenting on the pediatric vaccines that we have. We also say good morning to members of the media and members of the viewing and listening public. So I'll first begin with the summary. If I could have the first summary page of the COVID-19 update for August 29, 2021. So we begin with the testing done at both public and private now stand at 307,291. Over the last 24 hours, we would have still reported 185 new positive cases, taking our total positive cases to date from the 12th of March 2020 to present to 44,481. Our recovered patients thus far, 38,611. Total active caseload now stands at 4,592. with total persons in home self-isolation at 4,035. We have now 1,278 deaths, and condolences to the family of those who would have lost loved ones over the entire period. And the number of patients now in hospital now stand at 283. Those in step down, 89, and those in quarantine facilities at 139. As of 4 p.m. yesterday, those who would have received the first dose of a 2-dose regime stands at 505,067. Completed vaccination, those persons who would have received 2 doses of a 2-dose regime, now 392,519. Those persons receiving the single-dose regime, 1,397. And those persons completing vaccination, 393,916. Just a little breakdown further into the hospital cases. At the Couva Hospital and Multi-Training Facility, there are 58 patients, 15 of which are in ICU and 12 in the high dependency unit. At Cora, 18, Augustus Long Hospital, 47. There's no one at St. Anne's with COVID at this time. Arima Hospital, 44. The New Point Fortin Hospital, 41. St. James Medical Complex, 33. And the Scarborough Regional Hospital, Fort King George, 37. Followed by Scarborough Regional Hospital, Signal Hill, 5. If I could have my first slide, please. So, yeah, third slide. We go forward, and I'll be giving a short update in terms of, if we could go forward, one slide, please. Next one. Last one into the slides. Yeah, so we're going to do vaccine percentages for the entire population, which I just gave an idea of. The first bar on your left, 505,067. The middle bar, 393,916. And the total persons received number of doses so far, 899,243. Next slide. So just to break down those persons in terms of vaccination who would have been in the high dependency unit, and if you note the top of the slide, it says it's not only patients that are in the HDU at this point in time. It includes admissions from July 27 to 2021 to present. So roughly about a month of people, and our number of persons who would have been in the high dependency unit during that time gives us a total of about 106. Now, if you look at the pie chart said fully vaccinated during that period. We would have had 1.9% fully vaccinated during that entire period. The rest of it, 98.1%, would have been not fully vaccinated, meaning unvaccinated. And it is broken down further in the table on the right, where you can see those who would have received the first dose, 19 persons, 17.9%. Second dose, we had 0 at that time. Unvaccinated, 85%. Not fully vaccinated, 98.1%. And fully vaccinated, 1.9%. Second, if I can have the second pie chart, which speaks to ICU admissions, similar format, and we're seeing fully vaccinated accounting for only 0.6% of all the persons that would have been admitted to ICU between the period July 27th to present, and that accounted for 155 persons. And again, the not fully vaccinated are 99.4%, seeing again a trend of persons who are fully vaccinated not being admitted to the ICU or the H2 in any great number. Last slide. So the last slide, as I would have mentioned at the Prime Minister's press conference on Saturday, again, we're looking at the fully vaccinated, is that very small segment in the middle, now accounting for 0.3. This is because if you look at the top of the slide, we're checking from May 9th, 2021 all the way to present. So the total number of deaths during that period would have been 1,068. And we would have had only 3 deaths in fully vaccinated individuals during that period. As I mentioned, that accounts for 0.3%. Therefore, not fully vaccinated persons dying would have been 99.7% of the persons. And again, those 3 people would have been cases that would have had comorbidities, a number of comorbidities, very critically ill persons otherwise. So I think that's the end of the slides for this morning, but just the way of update, I would have liked, I think the Honorable Minister would have announced on Saturday that we are rolling out the Johnson & Johnson single-dose vaccine across the country. Just to give an update in that regard, on Wednesday, we will begin that process so that all health centers throughout the country, all mass vac sites, both private and public, including drive-thrus, will have Johnson & Johnson. So you can feel free to visit any of those sites. There will be walk-in or drive-in sites. There's no appointment that will be needed. Thank you all. That's my update for this morning.
Thank you, CMO. And welcome Dr. Camille Green, who will further emphasize why it's so important to be vaccinated and the benefits of vaccinating children. Dr. Green, good morning.
Good morning. Thank you for having me. Could I get my slides, please? Okay, sure. So, why vaccinate? So, children have always benefited from vaccinations. Next slide, please. So, vaccinating children is not a new thing for us. In fact, by the time your child is 12 years old, he or she would have received about 42 vaccines, most of them combined. 21 of these by 6 months of age, 33 by age 2, and 42 by age 12. These include, and there are some big names, diphtheria, tetanus, pertussis, hepatitis B, Haemophilus influenza B, pneumococcal, mumps, measles, rubella, yellow fever, and human papillomavirus. And for some children, they would have had even more if they've had influenza vaccines, chickenpox vaccines, or rotavirus vaccines. For all of these vaccines, parents have generally trusted pediatricians and the health center nurses to administer these doses without any concerns. Next slide, please. Hesitancy is not new. In fact, in the last decade, most of you would remember the human papillomavirus introduction in Trinidad and Tobago. It's a great vaccine, and it was developed to prevent cervical cancer and other genital viral infections. Cervical cancer was at the time, and still is, one of the top 3 causes of death in women in the Caribbean. And at the time, some of the concerns expressed were, it's new. Fainting was a side effect, and that was a big problem for many parents, even though we know that in adolescents, fainting is a common symptom because of anxiety, and it's not specific to one vaccine. And the last one was, will this encourage my teenager or preteen to have sexual intercourse? And now, most children, 10 and older, get the HPV vaccines, and it's on our national schedule, and the uptake has improved significantly. Next slide. We all know that prevention is better than cure. Every day in Trinidad and Tobago, adults and children are infected with COVID-19. Every day someone dies from COVID-19. Our numbers have been hundreds of infections, and deaths have always been in the tens, and there are few and far days in between where we've had no deaths. When will we accept COVID-19 vaccines? We know human nature is generally reactive. When numbers are large or deaths increase, we tend to react. Let's not wait for children to start to become extremely unwell and die. We're seeing it in the developed world where Delta virus is very virulent and spreading rapidly. And we know it's not going to spare Trinidad and Tobago. It will be here soon enough, if not already here. Now is the time to get your 12 to 18-year-olds vaccinated. That way, they'll be prepared with an immune response and armed and ready for any infection, especially the Delta infection. Next slide. Every single vaccine approved for children undergoes rigorous scrutiny in trials. And the bodies are well-recognized bodies like the Center for Disease Control and Prevention, the World Health Organization, and Pan American Health Authority. Pan American Health Organization, sorry. And in fact, all of the vaccines that we give in Trinidad and Tobago have been approved by PAHO and have been approved for decades and used safely. These regulatory panels scrutinize the results of trials and ensure that benefits outweigh risks before approval. They always have, and they continue to do so. Next slide. And what are the benefits that we get? Immunity to the virus, reducing the risk of serious disease and death. We get closer to herd immunity. And herd immunity is a term that has been spoken about on numerous occasions since this pandemic arose. And it really tells us that if the majority of people are vaccinated, the virus becomes almost non-existent in the population, and thereby protecting those who cannot be vaccinated. For example, the less than 12s and those adults who are unable to be vaccinated because of a medical condition. We'll have earlier and safer return to in-person classes at school. Every parent is aware of the effect that this pandemic has had on their child. School is very important for interaction, for socialization, and for communication. These children are under psychological and emotional pressures. They are scared, they are anxious, and they want to get back to school. The only way we can get closer to being in this normal state, especially for children, is to add vaccinations to what we are already doing. And of course, the benefit of reopening our economy. Next slide. So what are we taking away here? Vaccines are not new. We have 300 years of vaccines being in existence. Children have always received vaccinations to prevent sickness and death, and families have always trusted the experts to give these vaccines. COVID-19 infection is everywhere. COVID-19 vaccines are accessible throughout Trinidad and Tobago and is free of charge. Pediatricians are encouraging you and your children 12 years and older to get vaccinated, and there is priority for the 12 to 18-year-old group. To end, we really do not want to see your child in hospital. Thank you.
And thank you very much, Dr. Green. We now welcome Mrs. Henney, who is an addition to the expert panel. She brings another perspective as an executive member of the medical team. She is a general manager of nursing in the NCRHA, which has primary responsibility for 4 COVID facilities. She will bring the COVID-19 patient experience to you, and share that COVID is a serious disease and that we ought not to be complacent. We welcome Mrs. Henney.
Thank you, Mr. Alexander. Good morning to the Chief Medical Officer, Dr. Rushan Parasram, Dr. Green, members of the media, and members of the listening and viewing public. Happy Independence. I am thankful for the opportunity to serve our country on another level, which is to be part of this most esteemed panel as we fight together the invisible enemy, which is COVID-19. Through this dialogue with the national community, I hope to engage the population in discussions that will shed light on caring for the acute COVID-19 patient, by providing a first-hand perspective into the journey of a patient in the ICU. Secondly, I want to share a little about the maintenance of the quality standards of care in the parallel healthcare system. As we continue to provide care, we want to ensure that vaccination and the uptake of it, which is so relevant against this enemy, is continued in a robust way. We want to also speak about the role of infection and prevention and control caring for self and the caregivers, and the psychological support for nurses and also the patients. When COVID-19 would have entered Trinidad and Tobago, our nurses throughout the country, we answered the clarion call. We knew that this was a time in history that we would have to rise to the challenge because of what we had seen happening all over the world. But through this experience, there was a lot of visible leadership that inspired us, that encouraged us, that made us knew that we were not alone in this fight, in the form of the Prime Minister, the Minister of Health, the CMO, all the CEOs, as also the CNO, who is the Chief Nursing Officer, Ms. Betty Ann Pilgrim. We accepted the fact that we were in a war and we were ready to fight. What are the strategies that we employed? We radically employed training to the point where we were so exhausted with the training because we wanted to sharpen the skills and competencies that are necessary for managing the care of a COVID-ill patient. We approach this virus in a different way. We had to have a lot of out-of-the-box thinking, systems approach, restructuring, closing the gaps to take care of the patients who are very valuable to us. We here in Trinidad and Tobago, we stand as nurses together, united as the patient advocate, as the champions of the patient. We bring patient connectivity to the rest of the world because, as you know, in these COVID facilities, there's limited and restrictive visitation. So we become the surrogate family of the patients. We hold their hand. It's not an easy thing to see a patient after you would have nursed them for weeks because those are the type of time span that patients remains in the hospital. And you get close to them and you encourage them and you take care of them to the best of your ability. You become their family, away from their family. The patients, we also bear their psychological burden. We share their pain, we share their joys in the midst of our own challenges. And we are continuing to do so because we recognize as clinicians, we have a responsibility to safeguard the health care of our nation. I applaud all the nurses, all the clinicians, and all because we work together as a team. What COVID has done, he has brought the healthcare system as a stronger team. We are no longer operating in silo in no way because we realized as we partner with you, the public, it is imperative that we understand that as we fight this war against COVID, all of us have to unite. I want to briefly tell you about a situation with a patient who is a young man. You know, young people, I want to send this out to you. You know, some people wait until it's too late and they come into the hospital because of stigmatization. And he came into the hospital and we had to intubate him. And I would see the misery on his face. I saw the misery and I saw the hopelessness as he felt as he gasped for breath. But these are the scenes and scenarios that nurses face daily. I want to encourage all of us that even regardless of what we feel at this time, of course we know there has been some vaccine hesitancy, but we would have opened up the vaccine ability to get different vaccines because of the ones that are now in stock. I want to ask you to take advantage of this so that Trinidad and Tobago, we could have celebrated independence tomorrow together. And we want to continue to encourage you to wear your mask, social distance, wash your hands, and above all, vaccinate, vaccinate, vaccinate. And in my mind, vaccination is the best PPE for any healthcare worker and for protection from the public for each other. Thank you very much, Al.
Thank you very much, Mrs. Henney. We now go to our question and answer segment. We once again remind our media representatives to state your name and the name of the media house that you represent before asking no more than 2 brief questions Please ask your questions one right after the other to the relevant member of the panel. We will accommodate a second round of questions if time permits. We now go to 103 FM. Good morning.
Hi, morning everybody. I have a couple of questions. Firstly, to the CMO. There are growing concerns internationally about waning immunity provided by COVID-19 vaccines. Are there plans to offer booster shots in Trinidad and Tobago to certain persons, given that we do have shots in stock? And can you say if there are any fully vaccinated persons currently warded at hospital with COVID-19 at this time? Also, just for a point of clarification, I'm not sure if my connectivity had some issues when you mentioned CMO, the J&J rollout, but I missed a portion of what you were saying. So I don't know if you could perhaps repeat what you said about J&J and maybe elaborate, just in case it wasn't my connectivity and it was overall connectivity that was the issue. Thank you.
Okay, sure. So in terms of boosters, yes, generally speaking, there are studies for different vaccines that are showing different durations in terms of the protection from one vaccine and the next, right? From the start of the vaccination program, I think we have spoken about the possible need for boosters for varying vaccines. The Pfizer vaccine manufacturers has applied to WHO to administer a booster shot, a third shot. So they are the only ones, I believe, that have already applied to WHO. As you know, we stand on the back of WHO's policy as it relates to vaccination in terms of our policy for Trinidad and Tobago. And we'll, of course, wait until WHO gives the green light for Pfizer to be used as a booster. In the meantime, I suspect that other vaccine manufacturers will do the same. AstraZeneca, for example, has been shown research that there's a longer lasting protection with AstraZeneca as opposed to other vaccines possibly, even giving the possibility of lifelong protection. But what we see is, again, based on time, we need time to do the research to get the data in, and of course we'll be looking to WHO in the near future. And if they do approve it as a booster, and of course we have vaccines in stock, the plan will be to make sure we get the majority of people vaccinated, fully vaccinated first. And of course, if there are vulnerable people that require boosters, then we'll go down that way, but we wait and see what the data shows us. By way of the asking if there were persons in the hospital who are fully vaccinated, a portion of the ICU data and the HDU data that I would have presented would have been present. So yes, and even on the ward level, a very, very small percentage of people who become hospitalized are fully vaccinated. I would have put that about 98.1% for the people in HDU over a month, and just above 99% for those in ICU, and of course 99.7% of the deaths were not vaccinated. So it gives you an idea. In terms of the Johnson & Johnson rollout, again, just from Wednesday coming, next week, day after the holiday, it will be available in all health centers, all mass sites, including private and public, as well as the drive-thrus. And no appointment will be required.
Thank you very much, CMO. We now go to AZP News. We are ready for your two questions.
Good morning, Private Harry, azpnews.com. My two questions are for the CMO. CMO, firstly, I want to clarify the updates that the ministry gives in terms of the first dose and the second doses, right? The latest update, 831, shows that the total person vaccinated with the first dose of a two-dose regime, 505 and 67, and those with the second dose of a two-dose regime, 392, 519. So I want to find out if someone gets who got a first dose gets a second dose, would you minus that figure and add it to the person to the second dose regime? What I'm trying to find out is at any given time, how many people would eventually become fully vaccinated? That's my first question. And my second question is, I know that the policy of the ministry is that you have to wait 3 months after you contract COVID-19, but there are some studies that is recommended that you can get your shot as soon as you test negative. Is there going to be a change in policy of the ministry with regards to that? Thank you very much.
Okay, so I don't know if I understood the question fully in the first instance, but I will try my best. So just to go over the update from the 831, which is the one you cited, total persons vaccinated with a first dose of a two-dose regime, 505,067. Total persons vaccinated with the second dose of a two-dose regime, 392,590. And I think you're asking is how much of that will be converted, right? So generally speaking, if we take this date and time and we stop 505 persons 67, the regime that we have been using over the past few weeks is mainly Sinopharm and Pfizer. Those have a 3-week sort of window for your second dose. So the second doses should meet the first dose, 500,000, in about 3 to 4 weeks from now. So those will eventually come up to meet them. So I think that's the question you were asking, prior. Yes? All right. And the second question related to the 3-month post, that we took that decision a few months ago, if you remember, and it was originally 6 months. The policies will continuously be reviewed in alignment with what is happening with WHO, all the new decisions that are taken into account, but it's being guided by making sure that the acute phase of the illness is past. And as you know, there's a phenomenon called long COVID, and we have to make sure that that person has fully recovered from COVID before we give that additional dose, first dose or second dose. So we stick to the 3 months for now, and we'll continue to review it.
Thank you very much, CMO. We now go to CNC3, Guardian Media. Good morning.
Hi, morning everyone. Rashad Khan, Guardian Media. CMO, 2 questions to you. The first one, the 10 children that would have been mentioned on Saturday, I believe it was, that were in hospital with COVID-19. Can we have an update on their status, if anybody has been discharged or anything like that? And my second question to you is, have we seen any sort of adverse reactions to the J&J yet in this week or so that we've been administering it? Thank you.
Yeah, so basically in terms of your first question, we still have 10 pediatric patients in the hospital. There is not the same 10. We had 1 discharge, I believe, from the Point Fortin facility and 1 addition of a person. We have 9 ward level cases and 1 person in ICU at this time. In terms of the total number of cases of persons with MIS-C, you remember we would have quoted from the start of the epidemic how many children would have had MIS-C. We are now at a total of 52 persons in the country that would have been diagnosed as MIS-C either by an antibody test or by a rapid PCR test, antibody plus symptomatology. So in terms of the Johnson & Johnson, generally speaking, there hasn't been any severe allergic reactions or any type of, as far as I am aware of at this point in time. So nothing by way of severe side effects so far. There have been some mild, as you know, side effects, which is pain at the injection site, fevers, lethargy, those kinds of scenarios occurring. Dr. Green would have spoken to, generally speaking, you have feeling of dizziness sometimes after vaccination because of the anxiety. And we would have had Dr. Otello on giving a long discourse as to anxiety related to vaccination and how that affects dizziness and syncope. So more or less along those lines.
Thank you, CMO. We quickly move to Radio Tambourine for your 2 questions. Radio Tambourine, are you there?
Yes. Good morning, Clayton Clark, Radio Tambourine. All right, 2 questions. The consent form. Forgive me if this question was answered last week. I wasn't at the press conferences. The consent form for children ages 12 to 18 to complete for vaccination did not have a choice of vaccine, giving them a choice as to which vaccine they would like to take. Why was that not been considered, and do you think that contributed to hesitancy with taking the vaccine? And on the issue of hesitancy, has the ministry been evaluating how effective are the measures engaged thus far to have the population take the vaccines? Are other strategies being considered or being utilized at this time?
Okay, so in terms of your first question, the reason there's no choice at this time is because there's only 1 vaccine approved for use in Trinidad and by WHO for use in children 12 to 18 years of age. So there's no choice if there's only 1 vaccine. In terms of strategies, of course, as the campaign goes on, the Honorable Minister would have held a meeting with the CEOs, this morning, and we are reviewing, of course, the communication strategy continuously as we go forward to try to reach those individuals that have not yet gotten their vaccine. So there's continuous review of the communication plan as we go to different phases of the vaccination program.
Thank you, CMO. We now move to CL Communications. We are ready for your questions. Good morning.
Hi, good morning. Natalie Singh, Caribbean Lifestyle Communications. I was just wondering, what's the vaccine uptake by the teachers group? I know mention was made that it's not at a satisfactory level. And then my second question is, what sites can those teachers go to get vaccinated, if in fact there are specific sites for the teachers? Thank you.
Yes, so the teachers can go to any of the sites that Pfizer was made available to the children, which I believe is available on the website. So in terms of the same sites that were available to the children and the pregnant women, teachers can go to that same site. Just a reminder, in terms of the policy, teachers and healthcare workers have been added to that list of persons that can now access the Pfizer vaccine. The second question, if you just remind me of the second question, please. Or the uptake from the teachers. Yes. Yeah, I don't have the exact figures in terms of the uptake, but we have worked with the teachers for quite some time now. We had gotten a list from the Ministry of Education, so we can probably try to reach out to Education and see if I can get an up-to-date figure for you and give you that offline.
Thank you very much for your question. We now go to the Express. Good morning, Express.
Good morning, Kim Bodram, Express. My two questions are for the CMO. CMO, so just to be clear, is that 11 children who would have been hospitalized in total with COVID-19? You said it's not the same 10 in hospital at this time, and wishing them all the best. Also, with respect to patient confidentiality, the country is obviously concerned with this development. Is it possible to share the ages, and I don't know if the genders of these children have been disclosed, but is it possible to share that, giving people a better idea of who is being affected? Also, do you, basically as head of government's COVID-19 medical response team, agree with the extension of the state of emergency? There's been some negative feedback from the population saying they don't believe it's justified. And obviously government is maintaining its science-driven position. Do you agree with the extension of the state of emergency? Thank you.
Okay, so just take your question. So in terms of the 11 cases, so there were 10 cases in hospital at this point in time, pediatric cases. We cannot disclose the ages or sexes at this point of the children for reasons of patient confidentiality, of course. And I think the minister would have gone into length as to why we don't do that. So basically just to say that they would have spanned the entire gamut of from 0 to 18 years of age, to give a better idea. In terms of this SOE, I think that matter was ventilated before the last week by both the opposition and the ministry, and I don't want to comment further on that in that regard.
Thank you very much, CMO. We now go to Power 102. Power 102, good morning.
Hello, good morning. Sparkle McIntosh, Power 102 Digital. Both of my questions are for CMO Paris.
Okay.
The positivity rate stabilized, or I'm not sure if you can hear me, but I will proceed with my question.
Go ahead.
Okay, CMO, can you give an update as to whether or not the COVID positivity rate has stabilized or decreased, given that there has been a decline in the rate of testing? Additionally, can you say if consideration is being given to whether or not cruise ship passengers would be allowed into Trinidad and Tobago this coming season? Thank you.
Okay. Yeah. In terms of the positivity, we have been generally hovering between 25 and 30% for the last couple of weeks, which is a decrease from when we would have seen the spike in the middle of June, May, where it would have gone up to as high as 44%. So we are somewhere between 25 and 30%. There generally hasn't been a significant decrease in the amount of testing. We're still seeing about 800 to 1,000 tests when you take an average of how much we do per week. In some days, of course, you'll get less. On the weekends, generally, you tend to see a dip because the health centers are closed during that period of time. In terms of the the cruise ship, of course, that again is a matter for the cabinet of the country to make an ultimate decision. Health and other stakeholders will be putting in our recommendations to the cabinet in that regard.
Thank you very much, CMO. We now go to TV6. TV6, good morning.
Hello, good day.
You're ready for your questions.
Hi, morning. Renata Cutting, TV6 News.
Yes.
I want to thank the ministry for giving us the information, definitely the raw data, as to the number of persons vaccinated and unvaccinated who have contracted the virus and who have unfortunately passed away. But I would just like to request that the ministry, if you all could scale the information for us, just to give us the context so that we know what is the incidence of mortality and infection among both populations, considering, of course, that at any given point in time, there are a lot more unvaccinated persons in the country, and so it's more, of course, likely that these persons will turn up infected and die. I don't know if I'm being clear on that. If we could have the actual incidence among the population so that we get the true picture as to the... Hello?
So I understand a little bit of what you're saying. So basically you want to find out what is the chance of any one individual in this country being infected, and what is the chance of a vaccinated or unvaccinated person being infected. We take both things to be the same. So they cancel each other out from an epidemiological perspective to some extent. We have variances in the way that the positivity varies from time to time. That's why we try to give you these figures over a period of time. So it's been given from May to present, which is quite a large number of months. So you're able to tell over that large period of time what percent of the overall has passed away. For individual risk, it is extremely difficult to do that individual level risk assessment. As you see the number of vaccines increasing in the population or the number of viral illnesses decreasing, you have changing risks over time. That's why we try to give you the number of deaths over a large period of time, so it sorts of deals with the fluctuation in both viral load as well as the increase in vaccination in the country. I hope that answers to some extent what you're asking.
Thank you very much, CMO. We quickly move to the Newsday. Newsday, good morning. We are ready for your questions.
Good morning, Clint Chantak of Newsday newspaper. My two questions to the CMO. The first one is, seeing that we're having a lot of positive responses from most education stakeholders for this, having 12 to 18-year-old students being vaccinated so that face-to-face classes could continue. Is there any move to ramp up the distribution of Pfizer to them, particularly more than is currently being had? And also, I was curious as well, given the different sectors that are currently being reopened, as you know, we have vaccination and all of these things going on. With this
okay, Mr. Chantak, could you repeat the second question? Could you repeat your second question, please?
Yeah, the second question is there a particular reason why the cinema sector has not been allowed to reopen at this point in time, considering that their arguments have been that they were maintaining very stringent protocols, and they had virtually zero to no types of incidences prior to the current spate of measures we have. So my second question is basically, is there a particular reason why that sector is not being allowed to reopen at this point in time?
Okay. So by way of your Pfizer question, I think it was announced as well on Saturday that we are considering changing the way we distribute the Pfizer vaccination to children. That is being considered between the Ministry of Health and Ministry of Education during this week, and hopefully some announcements will be made later on in the week. As it relates to any sort of sector of the economy, and we have maintained from the start, health plays a role in terms of the recommendations that we make to the Honourable Prime Minister and the Honourable Minister. The ultimate decision lies with the Cabinet and both ministers in terms of the decisions for that sector, and we will continue to make our recommendations for various sectors based on the technical reasons.
Thank you very much, CMO. We now go to TTT for your two questions.
Hi, good morning, everyone. Sunil Lala from TTT News. CMO, there continues to be concern worldwide about the use of ivermectin. I hope I got the pronunciation correct. but there continues to be concern about that, people using it to treat COVID-19 and so on. Can you say where this is available, if and where this is available in the country, and whether there are any regulations or any move to regulate it even more, so people don't buy this and treat themselves as it is being done throughout the world as well?
Okay, sure. If you would recall, there was a press release a couple of weeks ago from the ministry indicating that the only WHO and drug approved for treatment of COVID-19 is the IL-6 receptor inhibitors at this point in time, and we made note of ivermectin as one of the drugs not to use for COVID-19. I have also written to the Trinidad and Tobago Medical Board, as well as the Medical Association and the Pharmacy Board, so that they can get the word to their membership that ivermectin is not to be used for this purpose, hopefully to help in that way. And anyone found with instances of using that for that purpose should report it back to the Ministry of Health. So thank you very much for raising it.
We'll now move to follow-up questions. So we'll take one question from Radio Tambourine. Radio Tambourine, we're ready for your follow-up question.
Yes, good morning again. My follow-up question. The Prime Minister mentioned on Saturday that the reopening of churches and religious organizations are being considered. Any talks or evaluations or approaches been made for the reopening of gyms and fitness centers? Question to this CMO.
Okay, sure. So I mean, I could repeat the answer that I gave for cinemas. I mean, we always consider the public health risk. There are many factors to consider when we make a recommendation for one or the other to be open. And again, ultimately, the decision is for the Honorable Prime Minister. So I wouldn't want to preemptively say what is being considered for any one or other sector this time.
Thank you very much, CMO. We now take a follow-up question from CNC3, Guardian Media.
Hey, morning again, everyone. Okay, so CMO, I just want to follow up on Radio Tamburine's question there at the risk of somebody calling me the devil or the Antichrist. During the earlier stages of the pandemic, right, earlier this year when we had persistent numbers coming up, even though we had a lot of restrictions in place, right, churches and religious organizations were found to be one of the main contributors of spread. So what is going to be done differently now, considering this higher level of virus within the population, so that we don't end up seeing that situation occurring again?
Okay, certainly. So there's a big difference between the last, I would say last year, 2020's epidemic in Trinidad and this one, and that's really and truly that we have vaccines at our disposal. So having a vaccinated public, generally speaking, even in churches, play a significant role in the way these sectors can open safely. You saw the initiative of course, vaccinate to operate, but vaccinate to educate, the statement by the Honorable Prime Minister to have children in school who are vaccinated. If you have vaccinated individuals in those same environments which you had last year, where you have unvaccinated people, the risk is quite different. So I think that's the main factor to consider. Noting fully that the phase 1 of the reopening of the vaccination program for Trinidad and Tobago would have been heavily charged towards persons over 60, and of course healthcare workers and those with comorbidities to try to protect the vulnerable. We have to look and see all those factors, how they play, and make decisions based on those.
Thank you very much, CMO. We now go back to AZP for your follow-up question.
Hi, good morning again. It is a follow-up to Rashad's and to Clayton's question. Just want to find out what is basically the logic in going to open churches and beaches remain closed. You know, it seems that you know, the beaches are open air, whereas churches are closed settings, and therefore, you know, it is easier to spread COVID within churches rather than beaches. So is there any consideration then in terms of opening the beaches? Thank you.
Probably without saying too much, generally speaking, any environment that you have to take off your mask poses a significantly higher risk than one in which you can have your mask on at all points in time. So that is a main consideration when you look at recommendations for public health safety of various places. So anywhere you take off your mask, whether it is to eat in terms of in-house dining in a restaurant, or any other space that people are in close contact, having your mask off is at a considerably higher risk of public health spread of an infectious disease from one person to the next that is spread in this way. We are seeing considerably high levels of spread in Delta virus, possibly the hint of aerosolization playing a significantly greater role. So, of course, having your mask off in any environment will lead to the increased risk of transmission of that particular disease.
Thank you very much, CMO. Our final question goes to TV6. We're ready for your follow-up question.
Hi. Well, I actually have two questions. I didn't get to ask the second question. I just wanted to get an update on how many pregnant women would have taken up the opportunity to get vaccinated since the rollout. And also, is there any way we could get an update on this investigation into the fake vaccination card fraud, if you have?
Right. So I think Dr. Sejru Singh would give a complete update on the pregnancy status when he comes on later on in the week. But I think the last number I heard was around 86 persons. But he will give an update when he comes in on Wednesday. I can't say much more on the second question with regards to I think that is being ventilated elsewhere. So I wouldn't want to comment at this point in time.
Thank you very much, CMO. Ladies and gentlemen, that's all the time we have for our question and answer segment. We want to thank the media for their engaging questions, and we certainly hope that the public would take heed of the information presented this morning by our subject matter experts instead of relying on the social media experts and the misinformation shared on social media. Please rely on the reputable sources for the information, such as the MOH, PAHO, WHO, and CDC websites for accurate and up-to-date information. Ladies and gentlemen, if it were not for the pandemic, many of us would be looking forward to seeing our servicemen and women on the Independence Day parade tomorrow in all their pomp and pageantry. Well, we spoke to some of these national security officers, and they have a special message for the nation. Let's take a look.
I chose to be vaccinated to protect and serve.
I got vaccinated for my family.
I got vaccinated for my country.
I got vaccinated for you.
I choose to be vaccinated for TNT.
I vaccinated for me.
For my family, for my colleagues, for my country. Vaccinate.
Let's do our part and vaccinate.
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 Let's vaccinate TNT.
Vaccinate.
Let's vaccinate TNT. We have come to the end of today's media conference. We ask that you please continue to protect yourself and your loved ones. If you haven't received your COVID-19 vaccination as yet, please get yours now. Remember, the COVID-19 vaccines are safe, they are effective, they are free, and they are available. No appointments necessary. So let's take back our independence from the COVID-19 virus by getting vaccinated. Happy Independence, Trinidad and Tobago, and goodbye for now.